after these premises, I would like to go more and more inside also the pharmacology and also the approach to diseases with the low dose medicine. We come from homeopathy as tradition, so we think that with even low dose medicine, it's important to cure the human being and not just the disease. It's important to act on the causes and not just on the symptoms. I already said that we have the possibility to talk to the big brother, the big boss of the body, which is the PNEI axis and the three main homeostatic control systems. It's important to always consider the psychosomatic and somatopsychic direction in the etiopathogenesis of every disease. To satisfy these characteristics, we apply the concept of the triangle of the therapy. In the afternoon, when we will discuss some protocols from the clinical research, always you will see that we apply the concept of the triangle. That is, first of all, it's important to drain and detoxify the patient. This is something that already Dr. Reker, the father of homotoxicology, said in the 50s of the past century. He wrote, "A good drainage is an half of a good therapy." He was another giant and a genius. Why is it is even more important in low-dose medicine, the drainage, and especially the drainage of the extracellular matrix. And I will show you how to do that. You remember the cell, the transmembrane receptor, the extracellular matrix, and the blood capillary. My friends, every substance, neuropeptides, cytokines, hormones, growth factors, but also oxygen, nutrients, vitamins, everything is released in the extracellular matrix. And like in a fascinating journey, they have to pass through the extracellular matrix to arrive to their target, the transmembrane receptor. What happens? That during our life, continuously, we deposit, we store toxins in the extracellular matrix, continuously. And I will show you what happens. Because storing toxins, we change the histology of the extracellular matrix. And healthy ECM is smooth, soft, transparent, like that one of a baby. The ECM of your grandfather is like a brick, brown, dehydrated. And being this way, it doesn't allow the passage of the molecules, or it allows much less. So, since we are providing through the medications of low-dose medicine, low doses, you understand that they are already low doses. If they cannot pass, they will not stimulate the transmembrane receptors. So, decide the first take-home, take care of your gut. Second take-home, clean your matrix, clean your matrix. In 26 years that I'm studying this matter, I understood that that's really the first starting point. The second part of the triangle we especially take care of is the PNEI rebalancing. Since every disease is expression of a PNEI imbalance. We have the privilege to have the words to tell the system to work less, to work more, and so on. So, first of all, good drainage is a half of a good therapy. This is a very nice scheme to understand also how to apply a good methodology of drainage. It's important to clean the extracellular matrix. Oh, sorry, what did I do? To clean the extracellular matrix. When you clean the extracellular matrix, you vicariate all the toxins from the extracellular matrix towards the lymphatic capillaries that vascularize the extracellular matrix. All the lymphatic capillaries go to the thoracic duct in the middle of the chest. Thoracic duct go to the left subclavian vein. And now, the toxins that first were in the matrix, then in the lymphatic capillaries, then in the thoracic duct, now they are in the blood. And through the blood, they arrive to the organ of excretions: kidneys, bowel, liver. This is the path that we need to make the toxins do. So let's go starting from the most important step in the total body detoxification therapy. How to drain the extracellular matrix. This is the extracellular matrix. It's a beautiful slide because you understand that ECM is between the internal environment, the cell, and the external environment. Everything happens into the cell happens before in the extracellular matrix. And it is the tissue we have between cells. Between cells, I stress you in the first part of the seminar about the concept that all the cells communicate each other, and they communicate through the extracellular matrix. The emails, they travel not through internet, but through the extracellular matrix. I always, now I show you the video, I cried when I saw it. 2 months ago, I mean, it's very recent. I always thought that we need to keep clean the matrix, otherwise no more bidirectional crosstalk. Nature, I mean nature, not Alessandro, they did something huge, great, because what you are going to see, it's a video of a real extracellular matrix and a real bidirectional crosstalk between cells. It's 30 seconds. I will show you twice so you will see well. So please look. Oh, no. Okay. It's in English, thanks God, so I don't have to speak. Okay, they identify microtubules between cells. And these microtubules, please look this, cell microtubules. These white spots are signaling molecules traveling from one cell to another cell. Microtubules are something like highway between two cities, where the two cities are two cells. So it's absolutely true that cells talk to each other using these words, which are signaling molecules. Very possibly through those microtubules, also viruses spread from one cell to another one. So I show you again, microtubules. So it's not, this communication doesn't happen only through the fundamental substance of the extracellular matrix, but there are these privileged channels of communication. Look, this is a cytokine, maybe. So I cried because I was not crazy. unbelievable, really unbelievable. But these microtubules are embedded in the fundamental substance of the extracellular matrix. If you have a smooth, soft, plastic extracellular matrix, the microtubule will be not rigid. If you have a toxic extracellular matrix, the microtubule will be sclerotic and will not allow any passage. So keep plastic the extracellular matrix. That's the rule to have success with the therapy. I would like to show you this multi-component medication that is designed for the detoxification of the extracellular matrix. Okay, look at the composition. First of all, it contains interleukin 6. Now I jump into molecular biology. Interleukin 6, pyrogenium, all the homeopaths know pyrogenium, hyaluronidase. These three ingredients keep plastic, soft, the extracellular matrix. They are able to take back the extracellular matrix, if you are 57 like me, having the extracellular matrix of a 30 years old young man. How do they work? Okay, I think it's very easy for you to understand hyaluronidases. Okay, it's the enzyme which digests hyaluronic acid, which is one of the proteins which forms the scaffold of the extracellular matrix. Interesting is also what does pyrogenium, what does pyrogenium do? Pyrogenium, some of you is homeopath, yeah or not? Okay, you. So you know pyrogenium, no? Pyrogenium in homeopathy is called a nosode. Just to have an idea for those of you who are not homeopaths, nosode is an whole term to mean more or less antigen. It's obtained by pathologic materials and so on. Pyrogenium, especially, is obtained by the putrefaction of cow flesh. But what we do in our department, we put, studying homeopathic remedies, lenses to read in a different way the remedy. The lenses of molecular biology. Well, putrefaction of cow flesh means that it is super rich of gram-positive and especially gram-negative bacteria, putrefaction. Stronger lens, gram-negative bacteria means a lot of lipopolysaccharides. Lipopolysaccharides are part of the envelope of the bacteria. Lipopolysaccharides are able to bind toll-like receptors of the dendritic cell. The dendritic cell in the immune system are some of the most important antigen-presenting cells. So they digest the lipopolysaccharides for the homeopaths, pyrogenium. They present the antigen to the CD4 naive cells, and they become Th1 lymphocytes. Th1 lymphocytes are those ones we will study in 15 minutes, involved in inflammation. So, giving pyrogenium, you provoke, according to this mechanism, a very little physiological control inflammation. Why little inflammation? Because you are not giving a kilogram of lipopolysaccharides, but an homeopathic dilution, D6, sufficient enough to stimulate the dendritic cell, but not too much to provoke a pathological inflammation. And why is important to provoke a little microinflammation? Because, my friends, inflammation is the only possibility that Mother Nature gave us to do what? To burn toxins. And where we burn toxins? In the extracellular matrix, because the extracellular matrix is the site of inflammation. So from one side, with pyrogenium, you are burning toxins in the extracellular matrix. And already Reykjavik explained that. Modern molecular biology discovered that pyrogenium is able to stimulate the production of metalloproteinases. They are enzymes similar to hyaluronidases, able to digest the proteins that we have in the extracellular matrix, making the scaffold of the extracellular matrix. Well, if you digest a little more these proteins, you understand that the scaffold will be less strong. I mean, the extracellular matrix will be smoother, softer, more plastic. And this is what happened giving pyrogenium, which is an ingredient of matrix, the multi-component to drain the matrix. You have seen that also interleukin-6 was present, no? In matrix. Interleukin-6 activates by itself directly metalloproteinases. So really now we understand in details how these multi-component medication work in order to keep plastic, young, soft, smooth the extracellular matrix. And a good matrix is the premises for a healthy condition. It contains tuja. Tuja is a very important remedy in homeopathy. It is maybe the most important remedy of that condition that in homeopathy we call psychosis, not psychosis, psychiatric, psychosis. In a modern way, we call psychosis mesenchymopathy, dysmetabolic mesenchymopathy. This metabolic pathology of mesenchyma. Mesenchyma is synonym of connective tissue, which is synonym of extracellular matrix. Psychosis is that condition of those patients that have the tendency to store toxins. They are exactly the opposite of myself. I am a phosphoric. I burn toxins because I have a kinetics of T3 and T4 quite fast. If you look at T3 and T4 hormones in psychotic homeopathic patients, they have T3 and T4 a little slower. That's the reason why they gain weight easily. They have proliferative diseases. Everything produced. Tuja is the remedy able to downregulate this tendency of patients. So, since matrix is the medication that counteracts the deposit of toxins, you understand that Tuja, by an homeopathic point of view, is perfect here. Don't forget that Tuja is also one of the strongest homeopathic remedy, Tuja occidentalis is a plant, against water retention. So, can be useful Guna matrix in cellulitis? Absolutely, yes. Not only for Tuja, but for all the other remedies. Just think of lymphatic vessels, stimulate the lymphatic circulation. But if you study Tuja not only by an homeopathic point of view, but for the lower dilution, also by a molecular biology point of view, you will see that the polysaccharidic fraction of this plant is able to increase what? Interleukin-1 beta, 6 and TNF beta, which are those cytokines involved in extracellular matrix solubilization. So TUJA works together with interleukin-6, with pyrogenium, okay, to counteract the rigidity of the extracellular matrix. It contains, look, Fucus vesiculosus. In phytotherapy, it is one of the most important plants to stimulate thyroid activity, to produce T4, levothyroxine especially. And levothyroxine in periphery is able to increase oxidative phosphorylation processes. When you have the tendency to store toxins, you don't have a good thyroid activity. That's the reason why we boost Fucus vesiculosus with tyrosine, phenylalanine, and histidine, which are the precursors, the 3 amino acids, precursors of thyroid hormones. So you understand how a multi-component medication is born, no? Concept of synergism, complementarity, and so on. Lymphatic vessel, already I told you, the toxins that we remove from the matrix are vicariated to the lymphatic vessel. In order to improve the activity of the lymphatic vessel, we use this Swiss organ preparation. And last but not least, it contains the hydroepiandrosterone, that is precursor of pregnenolone, which is precursor of steroid hormones. Why we inserted DHEA in matrix? Because when you detoxify a patient, you need also to give tone, strength. So he will support even better this challenging process of detoxification. This is really a wonderful multi-component medication. You will see that in more or less in every protocol, matrix is present, because every doctor who understands the importance of the extracellular matrix understands that if you want to boost every therapy, allopathic therapy, homeopathic therapy, acupuncture, where do you put the needle of acupuncture? In the extracellular matrix. If it is toxic, acupuncture will work less. Where do you release pulsatilla, homeopathic remedy? Here, always. So, it's really absolutely crucial to keep clean the matrix. And I present you the data of our study on Guna matrix, that is the name we use in Italy. University of Rome, Tor Vergata, Department of Clinical Sciences and Translational Medicine, about the effect of that medication you have seen on human dermal fibroblasts. You can see that that medication has a very strong antioxidant activity in comparison with the control. It's important to have antioxidant activity because oxidation is related to inflammation. Which is the site of inflammation? The extracellular matrix. So you understand this is a vicious cycle. If you don't break that cycle, you don't treat inflammation. And this is interesting because they measure with the Western blotting the quantity of type 3 collagen in the matrix using the control or using the medication. You can see very well that both collagen and fibronectin are deposited in the extracellular matrix in less quantity. And you can see, this is the most important one, that metalloproteinases 3, which are the enzymes able to digest collagen, are much more expressed using the medication than using the placebo. That's a great study because allowed us to understand why that medication, matrix, is able to keep plastic the extracellular matrix. When you have a patient with low-grade chronic inflammation, rheumatoid arthritis, all the diseases, it doesn't have more a plastic matrix, but a rigid matrix. So always, always, always consider to clean and detoxify it. Then you can also consider other medications in order to detoxify the body. Once you have removed the overload of toxins from the matrix and you are vicariating them towards the lymphatic capillaries, can be interesting also to improve the lymphatic circulation using other type of multi-component medications. And you can see that we have many phytotherapeutic components like Myosotis arvensis, Equisetum, Hydrocotyle asiatica, which are all substances with lymphagogue activity. And then it's important to vicariate the toxins from the matrix for the final excretion through one of the organ of excretion. And you can choose the bowel, the liver, or the kidneys. Which one is important according to the low dose methodology to choose? I write here. So always is important to clean the matrix. Can be important to sustain the lymphatic circulation, but matrix already does the work of lympho. And then you have to bring the toxins for the final excretion to the liver, to the kidney, or to the bowel. Which one combined to matrix or matrix plus lympho? That one that will stimulate the best organ of excretion in a patient. What do I mean? If your patient has a liver cirrhosis, you'll never combine matrix, lympho, and liver. Why? Otherwise, using liver would be the same to ask the liver, excuse me, you are insufficient. Plus, you have to eliminate toxins of all the body. The liver will say, okay, bye-bye, my friend. I have a cirrhosis and you are asking me to do the big job to detoxify the body? No, you will use kidneys. On the opposite, your patient is in dialysis. Would you use matrix, lympho, and kidney? No, you will vicariate towards liver. Is it clear this? Because it's absolutely important not to make the mistake to use the wrong organ of excretion. So, no problem detoxifying matrix using lympho, but be careful to understand clinically which is the best organ of excretion of your patient. I wanted to spend 10 minutes about this concept of the drainage and detoxification because it's really the base of our medicine. Okay? This is what I showed you before with this terrible this is much more elegant. Last but not least, interesting is also the composition of this multi-component medication that always we consider in chronic degenerative diseases. It is able to detoxify the cell, that's the reason why I wrote cell here. It is able to detoxify the cell, stimulating the Krebs cycle and the chains of transportation of electrons. But for all the homeopaths and experts in phytotherapy, I'm sure that you will appreciate the presence of Colchicum autumnale, Conium maculatum, Podophyllum peltatum, that both in homeopathy and in phytotherapy are considered three of the most important anti-degenerative and anti-neoplastic plants. So, every time you want to act on the metabolism of the cell, counteracting the degenerative processes, this composition can be very interesting. Don't forget also that it is rich in vitamin E, C, and the B group with antioxidant activity. With these different multi-component medications, you can manage very well the detox therapy of every patient. But please, you have, as clinicians, to understand which is the best organ of excretion. All right. Let me see time. You said 1 or 1:15?
No, 1:15.
1:15. So, I know that you are hungry. You are hungry. After 3 hours, maybe a little tired. I hope also a little happy. I hope. So, I need to find an agreement with you. Are you brave enough to resist 15 minutes? But you don't know doing what. Studying in 15 minutes immunology, because when you speak about immunology, when you speak about immunology as a speaker, you must be sure that you will be always wrong. Why? Because if you speak in a difficult way, all the doctors who are not immunologists, they will not follow you. If you explain immunology in a too simplistic way, there is always an immunologist who will say, look, that yesterday in New England Journal of Medicine they wrote that. So crucify me, I know. Actually, in all these years, I found maybe, now I try with you also in Ireland, the right compromise between something complicated and something easy. In every country it worked. I hope also here in your beautiful country. So, we need to create the premises now about the immune system, cells, in order to understand how to use cytokines to treat inflammation in the form of low-dose medications. So, do you want something easy? Yeah? Okay. Okay. This is the complete immune system cells picture, but it's absolutely crazy. So, if you follow me, I try to do something easier on the flea chart. I need really your attention now, but if we do this, my friends, we are okay. So, let's go doing something easier. First of all, as you remember very well, we have two types of immunity. The innate immunity, that is older, less effective than the innate adaptive immunity, but very, very fast. So, older, less effective, very fast. And we have the adaptive or adaptive immunity, which is very effective, a little slower, obviously, and by a phylogenetic point of view, younger. What happens in the mechanism? First, every pathogen is recognized by some cells which are part of a family named APC, antigen-presenting cells. To the antigen-presenting cell family are macrophages, which are the less sophisticated one. They are able to recognize a pathogen, to attack the pathogen, to digest the pathogen, and to eliminate the pathogen. Another type of antigen-presenting cell is the dendritic cell. This is a very sophisticated immune cell, because from one side it is able to do more or less the same that macrophage does. Neutralize the pathogen, killing the pathogen, not directly through digestion of the pathogen, but producing inflammatory cytokines and interferons. So, dendritic cell starting inflammation burns the pathogen. Or, if the pathogen is a virus, killing the virus. But, and this is really important for me in this moment, the dendritic cell is the cell between innate immunity, with the mechanism I already showed you, and the adaptive immunity. In fact, look at the flip chart. This is the pathogen. This is the dendritic cell. Dendritic cell on its surface have some receptors called toll-like receptor. Through toll-like receptor, dendritic cell bind the pathogen, internalize the pathogen, digest the pathogen, and expose through the major histocompatibility complex type 2, the pathogen has antigen, present the pathogen. To whom it presents the pathogen? To some other cells called CD4 plus cell naive. Naive means that they don't know if they will become Th1, Th2, Treg, Th17, and so on. According to the type of fraction of antigen dendritic cell presents to CD4 naive, and according to the cytokines produced by CD4 naive, they can become Th1 or Th2 or Treg. Actually, they can differentiate themselves even in other subsets. But we come back to these slides and we become crazy. TH1, this is the real important part now. TH1 are in, so CD4 plus naive can differentiate in TH1. They are involved in cell-mediated immune response. Remember, which kind of immune defense? Cell-mediated immune response. Why? Because they are big producers of interferon gamma, and interferon gamma is the signaling molecules that make another family of lymphocytes, CD8 plus cytokine, to become T cytotoxic cells. T cytotoxic cells are those cells that, when they see a cell infected by the virus, they kill the cell. They are those guys that, when they see a cell which is de-differentiated, which is becoming a neoplastic cell, they kill it. They have a scavenger activity. Cell-mediated immune response. CD4 naive can become TH2. They are responsible of humoral antibodies immune response. In fact, TH2 stimulate B cell to become plasma cells producing immunoglobulins. TH1 cell-mediated immune response, TH2 humoral response, Treg, interesting Treg. Treg are involved in immunotolerance. What does it mean? They are able to both downregulate TH1 and TH2. Of the three boys of the family, they are the nerds. These ones want to have parties continuously. Hey, let's go, blah, blah, blah. Treg are, no, Dad doesn't want that, okay? That are Treg. Okay, just to have an idea, otherwise you will be lost. So, homeostasis. Please help me now. If TH1 are in homeostasis, it means if you have the physiological number of TH1, they work doing their good job, cell-mediated immune response. But if TH1, instead of to be here, are here, they are involved in inflammatory processes. They are the actors of inflammation. TH2, if TH2 are expressed in homeostatic way, they are the good guys providing the humoral immune response. But if they are too much, they are involved in allergic diseases. Everybody studied that allergy is expression of TH1, TH2 switch. Instead, inflammation is expression of TH2, TH1 switch. Treg, the nerds. Tregs, if expressed in homeostatic quantity, are involved in immunotolerance. They take under control inflammation, they take under control allergies, but if they are overexpressed, for instance, in cancer patients, you have an overexpression of Treg. They downregulate too much both Th1 and Th2, and instead of to work in terms of immunotolerance, they work in terms of immunodeficiency. Is okay, this scheme, right? Okay. Please, a subset of Th1 is Th17. Just remember it because they are the lymphocytes involved in autoimmune diseases, okay? All right. Good. Okay. So, and then we go to have lunch. It's very important, so in 3 minutes I try to wrap up. But together, it's like a training, okay? We start from the pathogen. The pathogen can be neutralized by which kind of cells? Macrophages or dendritic cells. Why dendritic cells are even more important than macrophages? From one side, because similarly to macrophage, they can neutralize the pathogen. But even more because being the most important antigen presenting cell, they are between the innate immunity and adaptive immunity. They are able to bind the pathogen through the toll-like receptors. They process the antigen and they present the antigen through the major histocompatibility complex. Number 2, present the antigen to which other cell? To the CD4 naive. They are naive. They don't know what to do when they will be adult. They don't know if to go to the university to study engineering, economics, or medicine. According to the type of antigen presented by the IPC, they can differentiate themselves in Th1, Th2, Treg. Th1, if expressed in homeostatic quantity, they are actors of cell-mediated immune response. Good. Th2, involved in humoral immune response. Treg, immunotolerance. But if instead of to be here, they are expressed, are overexpressed, they become the actors of Th1, inflammatory diseases. Th17, autoimmune inflammatory diseases. Th2, they are involved in allergies, atopic dermatitis, allergic asthma, food intolerance, and so on. Treg, if overexpressed, are involved in immunodeficiency. So, it's interesting to always look at the immune system as a balance. And I will use this picture after lunch. Every disease can be the expression of up or down regulation of Th1, Th2, Treg. If you have a patient with rheumatoid arthritis, will be involved more Th1 or Th2? Definitively Th1. You have a patient with allergic asthma, it will be a patient Th1 or Th2? Th2. Can you, so I am an healthy guy in this moment. Th1 and Th2 are on the same level. If I had an inflammation, Th1, Th2. How can you tell Th1? Please, take it easy, calm down, chillax. Which is the language that Th1 understands? Cytokines. After lunch, we will use the dictionary to translate chillax in gamma interferon. Chillax in interleukin 10. That's the beauty of low-dose medicine, that you will use something natural to talk to the cell, whispering them, or hey, wake up. If I had an allergy, TH2 up, TH1 down, I need to wake up TH1. I have to say, hey, wake up. I will give you the dictionary for that. Now, we have to do something wrong. We have to alterate our gut microbiota, provoking inflammation and destroying the junctional systems of our epithelial monolayer. In other terms, we have to have lunch. Okay, after lunch we will study how to use cytokines as medication.